Good afternoon. Thank you very much for joining me today. We all know that COVID-19 has affected every one of us in every aspect of our lives for more than a year now. It's affected our schools, it's affected how we shop, how we interact with our family and friends, how we don't interact with our family and friends, how we celebrate, and how we grieve as well. But perhaps most of all, it's affected our healthcare system. When COVID arrived in Manitoba and across the country and around the world, it had the impact of pausing other medical priorities. In our case, thousands of surgical procedures and diagnostic appointments while we refocused on the fight against this virus. This summer, we were able to resume last summer, I should say, we were able to resume some of those procedures, but with the fall came, some would say, the first and second waves at the same time, but certainly an upswing in the need for our healthcare sector to pause in its other priority areas so that we could focus on redeploying staff and space to care for COVID-19 patients. I have said before, and I'll say again, I'm very, very proud of our frontline healthcare workers. They pivoted and they showed their adaptability in making our healthcare system respond and helping it respond to this fight with this pandemic head on. I think they make us proud of our fellow Manitobans. But we are still facing a serious backlog of surgeries and procedures that have been delayed due to COVID-19, and this pandemic pileup means that there are thousands of surgeries that have been delayed, and that number continues to grow. Each delay means a Manitoban that is hurting while they wait, and I think for most Manitobans, if they're not waiting themselves, they know of someone who is. Our number one priority is protecting our most vulnerable Manitobans and ensuring that the healthcare system's there for all Manitobans, not just during a pandemic, but after that pandemic is over. La priorité numéro une de notre gouvernement de protéger nos Manitobains les plus vulnérables et de veiller à ce que notre système de soins de santé soit là pour tous les Manitobains quand ils ont besoin pendant cette pandémie et bien après cette pandémie aussi. So that is why I'm pleased to announce today that as part of Budget 2021, our government is going to be investing an additional $50 million to focus on reducing wait times for surgeries and procedures. Some of this money will be specifically targeted to the backlog of hip, knee, and cataract procedures that we have, and there are others as well, of course. More details on this funding will be announced after Budget 2021 is tabled next week. We know that this $50 million additional dedicated to reducing the pandemic pileup is going to help. It's going to help to get better care sooner to Manitobans who need it, who've been waiting for it, and who deserve to receive it. Our government's been committed to reducing wait times in our system since we took office. According to the Canadian Institute of Health Information, that challenge that we rose to and faced has been met head on. We are, according to their most recent data, the only province in Canada that hasn't seen a growth in wait times, and this is pre-pandemic, remember. Every province is facing the pandemic challenges, and we'll see as the high numbers come out in future what impact it's had, but I would say it's safe to predict that it's worsened the situation coast to coast to coast. Now, because we faced this challenge before, we're equipped to face it again. In the face of this global pandemic, we recognize that this isn't a new problem. It's an ongoing problem. Our population is not getting any younger. With aging comes the need for additional treatments and surgeries. I've been raising this issue since I became Premier in 2016. I'll continue to raise it. Premiers are unified from coast to coast to coast and standing together knowing this is a significant healthcare is the number one priority for Canadians. And we have made some significant progress here in Manitoba, but we can't do it alone. And we need a partner with our federal government, as that's always been the case. And we need our premiers to stick together and make sure that such a partnership is strengthened and results from the efforts that we're taking. The need for healthcare has never been greater. The federal share of contribution to healthcare costs has never been lower in modern history. Provinces are now paying for nearly $4 out of $5 of healthcare costs, and that isn't how our system was designed, and that is not a sustainable way to go forward. We thank the premiers for their unity. We thank the Prime Minister for listening to our concerns, but we would all be much more thankful if there was action as a consequence of the unity that premiers have expressed around this issue. Last week, the Finance Minister previewed that there would be a one-time payment to the provinces for health care costs. We welcome any contribution that moves Ottawa in the direction of being a true sustainable partner to healthcare, but a one-time, one-year quick fix is not the answer to a long-term problem that's been growing over the last quarter of a century. Short-term solutions aren't the answer for long-term problems ever. And so again, I would reference, as has Premier Legault as the chair of the Council of the Federation on behalf of all premiers, that the federal government has a great opportunity in their upcoming budget to take a real step in the right direction. And we, of course, are encouraging them to do that. Je renouvelle notre demande au gouvernement fédéral de se présenter à la table et de restaurer son rôle comme fournisseur stable de financement des soins de santé. Today, I am renewing our call on the federal government to come to the table to restore their role as a stable provider, a supportive partner of health care funding. Canadians are waiting, literally, for Ottawa to answer that call. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Manitoba, Ian.
Good afternoon, Premier. Can you provide even an estimate today on how many surgeries will be addressed by this new funding? Will this cover the entire backlog?
We hope it'll make a good dent, Ian. As you know, we're in the midst of a pandemic, and so it's kind of a moving target to suggest this would, satisfy all the backlog at one foul swoop, because it may be growing as we speak, right? Our population's aging, the number of people who are being diagnosed and treated has been down as a consequence of COVID. As that backlog's addressed, these numbers may shift and change. We expect in an upward direction, sadly, and the wait times we don't want to grow. So the purpose of this additional commitment is a recognition that and that we want to make sure that we do what we can to make sure that healthcare of an appropriate type is available as soon as possible to Manitobans. And it's a pretty significant additional commitment that we've made in our budget. There'll be more details to follow as to allocations and prioritizations in the weeks ahead.
Thank you. Another poll is suggesting your party's popularity is slipping. What will your party do differently to attract the supporters you've lost?
Fight COVID effectively and work with our small business community and all Manitobans to restore the economic growth that we all want to see and the social betterment that we all want to see as a result of successfully standing up to COVID together.
From the Canadian Press, Kelly.
So earlier today, the vaccine task force said that there were delays in supplies rooted in the feds. How are conversations with Ottawa progressing? Is there enough transparency when it comes to Manitoba making vaccine distribution plans? And do you feel there's enough stability when it comes to shipment delivery?
Well, you raised four good points there, Kelly, and I didn't write them all down, but I'll try to do my best to respond. I think the dialogue with Ottawa on the prioritization of pursuing more vaccine supply has been pretty open and transparent. We've been consistent as premiers in saying we all of us have done our best to focus, and our vaccine team, I think, deserves to be commended for this, on expanding the capacity to deliver vaccines when they are received, but I think most provinces would say they have the ability to get more needles in arms if they had the vaccines. No reason to have a needle in your arm unless there's a vaccine in that needle. The other thing is that in terms of the transparency issues, I think overall here in Manitoba, our vaccine team's made itself available, as you just alluded to, on a regular basis. We've done, I think, a very good job of partnering, for example, with our Indigenous partners in the province to get vaccines to a lot of our rural and northern communities where needs are higher. We've developed a protocol in terms of an age-based structure that does make vaccines available in a structured manner. But as I said right at the outset, I think, Kelly, and I'll say again, this is a once in a lifetime, we hope a once in a lifetime challenge for all of us. Our vaccine team is facing up to it. There are no real precedents for a challenge of this magnitude. There are going to be hiccups along the way, and I just thank Manitobans for their understanding and patience. Manitoba is not the only province to have hiccups with its vaccine rollouts, but the fact remains that we have got, well, just in the last few days, I think 29,000 vaccines administered in the last 4 or 5 days. So we're getting there. The sooner we get more vaccines, I think the better Manitobans will feel about it.
And your government has obviously kind of had, to some extent, a contentious relationship with Ottawa when it comes to healthcare, being the last to sign the healthcare deal last time, and as well, you've been quite vocal in calling out for more funding. Are you optimistic that this is a conversation that we can have now that there's a global pandemic? Is it opening it up? Are you getting better responses from Ottawa around these topics?
Yeah, let's be clear. I think many of us have had this admonition from our parents. I have a brother that's within 2 years my age, and we were reminded frequently as young people that we weren't arguing with the person, we were arguing about the idea. For the Prime Minister and I, we've had, I think, a growing relationship of trust. We don't agree on everything, but two people will always agree. One of them probably isn't thinking. We're both thinking. I think I'm right on the need for the federal government to resume a stronger role in supporting healthcare, and I think the Prime Minister's wrong in not doing that. That being said, we can disagree and still have an ongoing relationship that is open and strong, and that's what I've always worked at with our Prime Minister.
From CTV Winnipeg, John.
Good afternoon, Mr. Premier. I hope you're well. A quick question for you about this new commitment. Where do you imagine the money will go toward? Do you imagine that there would be, for example, the ability to have more overtime with the existing doctors and nurses, or would you like to see that money go toward hiring more staff so that the capacity would go up?
Yeah, it's a really good question, John. I think we'll let the Health Minister and Finance Minister address these respectively. The reality is, though, that having these tens of millions, 50 million additional available does give us the ability to know, and for Manitobans to know, that we can whittle away at those wait times. I'm not suggesting that we're going to get them down to zero overnight. They haven't been at zero for a lot of years. But if we can at least address this pandemic pile-up of back surgeries, well, I shouldn't say back surgeries. I don't mean back surgeries. I mean surgeries that are backlogged, to be clear, because knees would be in that category, hips, cataracts, and there are others as well. Then this is going to make sure that we lessen the pain that each individual Manitoban who's waiting for those treatments and surgeries is experiencing right now. And that's really important. These are folks who have made a sacrifice as a consequence of the pandemic far in excess of what most of us have had to do because their pain has been prolonged and their chances to get surgeries that could address that pain have been delayed and put back. So we want to demonstrate our concerns for these folks in a real way and make sure that we don't allow these wait times to continue to grow. As we hopefully get towards the end of the pandemic, these investments will help even more to get people the treatment and the surgeries they need.
Thank you very much for that. Just on a different topic, we've heard that the provincial director of immunization clinics in Manitoba, Kurt Jansen, is no longer serving in that role. We're just wondering, whose decision was it for him to leave and why? And can you tell us who will be replacing him?
No, I can't tell you any of that. That'd be an HR issue. I expect we could get you the detail on the various personnel. There are changes that have happened and will continue to happen. This is a dynamic time. For example, in the early days of the vaccine team, we had folks who were helping in the setup that then moved back to their regular jobs, and new people moved in to replace them. And this is the nature of the shifting focus that our vaccine team has had on designing and building their structure and then implementing it. Different roles, different skill sets have been used at different points in time.
From City News, Jonas.
Good afternoon, Mr. Premier. Just want to kind of pick your brain, I guess, on a thought regarding wait times and COVID and what's happening in Ontario. If I'm, sitting at home waiting for hip surgery, and I know that my surgeries have been delayed because of COVID, not necessarily funding, and I'm watching variants rise in Ontario, I'm watching their ICUs get full, what's your message to them that this won't happen here after what happened in wave 1 and wave 2, that we are more prepared against the wave 3?
Well, I think it's demonstrated in some degree, and I say this with hesitancy, Jonas, because this isn't a victory lap, but we are, I think, 6th or 7th in terms of our variant cases. Our case numbers are down, our deaths are down very, very significantly, and that's good news. I think it makes Manitobans feel better and more secure, and it should. But, Easter's coming, and we all remember what happened at Thanksgiving. So hopefully we're different people now, and we're smarter, and we're not going to, we're going to be able to resist the temptation to do what friendly Manitobans like to do, get together and socialize with family and friends. And hopefully we can resist this for a little longer, get ourselves vaccinated. I encourage every Manitoban that is able to do that. And the more we can move forward on the vaccine strategy and the more Manitobans we can get vaccinated, the sooner we can start to reduce some of those restrictions that we must abide by now to make sure we're keeping each other safe. So when it comes to folks who are waiting, I feel particularly sorry for them. I watched my mother suffer for months and months and months waiting for a knee, and I mean, I've lived through this. Many Manitobans could tell you stories about themselves or their families and how hard it is. It's not an easy time, any time, to wait for a surgical procedure, but it's especially hard when it's delayed and delayed and delayed, and COVID has made that necessary because we had to leave that hospital capacity for COVID patients. They were our priority. ICUs obviously as well. We were concerned about the occupancy rates there. And so these are folks who need, I think, the special attention we want to give them, the care that we want to get to them. And so this contribution today that I've acknowledged is in some way an acknowledgement of our desire and our appreciation for folks who want and deserve to get health care, that they can get it sooner.
Thank you for that, sir. I guess just maybe a further thought on this. I mean, when we look at Ontario and how quickly things do seem to be spiraling there, is there any thought on, a public health perspective as we do work with these variants to maybe crack down a little harder than we did heading into the fall or into wave 2 and watch some of these indicators a little more tightly given what seems to be a younger cohort ending up in ICU and hospital?
Well, again, I'm not naive. We're not, we have some people who just simply don't want to respect health orders. I think it's a lot smaller percentage, a lot smaller number than it's been. I would hope that the additional security in terms of inspections, the ticketing, has had an effect. For some folks, they need to experience the loss of cash from their purse or their wallet in order to understand that the rules are real. But I think most Manitobans understand now more than they did in the fall. And remember, we didn't really have, you look at the graph, we didn't really have a wave like most of the country did, a first wave, and a lot of people didn't really, I'm afraid, buy into the philosophy. They had to be careful and so on. And we had a good summer. But when we got to Thanksgiving, you saw what happened. Manitobans, I think, saw what happened, and I believe most Manitobans have accepted their own importance in abiding by those health orders to protect themselves, their own obligation to protect each other. And I hope that we can do that same thing through Easter. This is going to be a challenging time coming up. I see the forecast, looks wonderful for weather. Hopefully people aren't gathering indoors in confined spaces, in closed spaces. I hope that if you gather, you follow the public health orders, and if you can do it outside, safer. If we do these things, we continue to get our vaccines here, we can be looking at sooner dropping of restrictions than would be the case otherwise.
From the Winnipeg Free Press, Carol.
Good afternoon, Premier. Back-to-back polls now show that the NDP are ahead of your party in Manitoba and would win if there was an election tomorrow. Do you think that you personally are responsible for that in any way?
I don't know. I didn't get any credit when we won the biggest back-to-back majority governments in the history of Manitoba, so I don't know how much you want to blame me for this, Carol. I'm fine with it, though. There's no election. There's only a pandemic. And so I'm focused on dealing with the pandemic, not the election.
Thanks for that. And Premier, why isn't your health minister making this health-related announcement and here to answer questions about the surgical backlog?
Well, my health minister is making announcements on a regular basis, Carol, and I'm glad to have Heather Stephenson in that role. I think she's doing a tremendous job, and I expect she'll continue to.
From the Brandon Sun, Colin.
Noon. How will this $50 million be divided up between Manitoba's health regions?
Fairly.
Fair enough. The other question I have is, you're making this announcement today. The finance minister made his announcement earlier in the week. Why release parts of the budget piecemeal instead of releasing everything in full context next week as scheduled?
There's too much good news in this year's budget. If we released all in one day, you'd miss half of it.
From CJOB, Will.
Good afternoon, Mr. Premier. Last July, your administration issued an RFP to help deal with some of the backlog of elective surgeries. I'm just wondering, can you give us an update on that initiative?
No, we can get you some numbers, I think, Will. Remember that we were able, because our COVID numbers were so good last summer and down, we were able to do some work there. But then, of course, after Thanksgiving, and this is another admonition, I guess, to Manitobans, remember last Thanksgiving that as the numbers started to come up, we obviously had to slow the ability to address some of the backlogs there. And that relationship's going to have to continue. If our COVID numbers were to come back up because of variants or for any other reason, this is going to interfere with our ability to give health care to people who really need it. And so if you're looking for another reason to follow those health orders, there's another one for you. You're saving lives. For sure, Manitobans have saved thousands of lives with the way they bent that COVID curve. Keep doing it, and we can help people who need a hip or need surgery on a knee or a cataract to get it sooner. It's a great motivation, I think. If you're thinking about other people, in particular seniors, this is a really important thing to remember.
Okay, thank you. And just a little more elaboration on the money being spent today. I don't know if you can give us this ahead of the budget day, but how did you arrive at $50 million? Why not 40? Why not 60?
Well, that's a tough question. I mean, it's a budget, so like every budget, you're doing a guesstimate of what you anticipate might be possible to do given the resources you have and the resources that you're also going to be allocating to that category. We think it's not unrealistic, and we take very much pride in our budgeting process as a government that we honor what we say we will do as opposed to some other governments previous. We have been very, very close in our projections up till this year. And I think Manitobans will give us a bye on this pandemic year for being off on our projections. But nonetheless, we are very careful and meticulous, in fact, in restoring Manitoba's image as a government that follows what it says it will do up with actual action. And that means budgetary considerations that are made are followed to the best of our ability. This has helped us in restoring a stronger relationship of trust, for example, with the financial analysts and the various companies like Standard & Poor's and Moody's that evaluate our performance as a financial entity. And that helps us by securing our credit rating, which had dropped under the previous government repeatedly. Because they were not close to doing what they said they would do, the financial evaluations didn't show that they could be trusted on their numbers. With our government, we have demonstrated that we can be, and so I'll just emphasize that we do take these projections seriously, and that this is what we actually anticipate we will be able to invest in addition to the what is one of the highest health budgets in the country of Canada, by the way.
Our final reporter this afternoon, Mr. Premier, from the Winnipeg Sun, Josh.
Good afternoon, Mr. Premier. Josh Aldridge, Winnipeg Sun. Do you know what the current number of backlogged surgeries are, and are there currently any surgeries that are not being done as just to kind of deal with the current backlog as it stands now?
Yeah, the last numbers, Josh, I'm sorry I don't have today, like an updated number for this day. The last numbers I saw were well in excess of 10,000 people in Manitoba were waiting. Saskatchewan's numbers, according to Premier Moe, well over 15,000 people waiting there. And I expect those numbers being, that was a few weeks ago, I expect they're higher now. So here again, the goal is to make sure we're prioritizing Manitobans who are waiting for surgical procedures and tests, to make sure that we're budgeting additional funds to help deal with the consequences of this pandemic on these growing wait times.
Okay, and I have a question about the news about AstraZeneca earlier this week. I've heard more and more about people who are hesitant to get a vaccine, whether it's AstraZeneca or the other vaccine. How big of a concern is this for you, with people with legitimate concerns about vaccines and now potentially not wanting to get a vaccine when it comes to restarting the economy, all the rest? We kind of touched on the need to get the vaccine, but how concerning is that vaccine hesitancy, and how do you guys plan to deal with that and address that hesitancy?
Yeah, I can say, and I think for many people it's a concern, obviously, when you see reports and hear reports of blood clots happening. Even though it's happening in a rare number of cases, the consequences are pretty severe of that happening. If that's associated with a certain vaccine, then it's clearly an element of caution that has to be taken in discussing whether you implement it or not. We've heard different comments from federal officials and international officials, quite frankly, on the AstraZeneca vaccine, and it concerns me greatly that Manitobans might be reluctant to take it as a consequence of these reports. That being said, I know how Dr. Roussin feels about it. I think he actually chose to demonstrate that he had faith in the vaccine by getting it himself. So, you know, our concern remains that that our people are safe and secure. And so our vaccine team acted out of an abundance of caution to say, you know, no, for now. We'll monitor and watch the information as it comes in on the 55 under directive that was issued. My concern is, of course, that I want as many people who can be protected by vaccines safely to get them as soon as possible. So yeah, for sure, there's a balance of concerns here and priorities. But I think, again, I support our vaccine team in their decision to exercise some caution around this until further data, further science can be made available. Just say thanks to everyone. In terms of positive things, first of all, happy Easter to everyone. Be smart, have a heart, stay apart, be careful out there, because over the next few weeks, as I understand in the month of April, we're going to get nearly 300,000 vaccines. That's the commitment that we've received. 300,000 vaccines will move us a long way, and they're all planned. We'd be happy to take more, but they're all planned for, and we'll look for Manitobans to take us up on the opportunity to get those. As of noon today, despite some hiccups late last week, I understand with some tech difficulties on bookings and some personnel shortages, that the wait times have come down. As of noon today, the reported wait time at the super site, the RBC Convention Center, was 0. Let's hope it can stay that way for the limited inconvenience of folks. But I know that from the feedback we've gotten, that Manitobans are really, really pleased to be able, when they get the vaccine, to feel a greater sense of security and confidence that they're not going to get COVID. And after all, that's what we're all about, is protecting our people. Thanks, everybody. Happy Easter.